I'm Natalie Graham. I'm going to be your student nurse. I'm from University of Detroit Mercy. I'm going to be doing your health assessment today. What's your name?
Sarah Trombley.
And what's your birthday?
July 3rd, 1994.
What's the date today?
March 31st, 2015.
And what brings you in?
Just a checkup.
Okay. Do you have any pain or you have any allergies?
Nope.
Okay. She has ANO times 3. She has good speech, it's not slurred, and she has good affect and mood, and she is dressed appropriately for the weather. Can you just stand up, please, and walk to the door and come back? Okay, she has good steady gait, and can you stand back up? And then can you close your eyes? I'm going to perform the Romberg test, and so I would do this for 30 seconds, and make sure she's not wobbling or has any trouble standing, and she doesn't. So you can sit back down, and she has good muscle strength when she has to sit and stand. Can you stand back up? Okay, I'm gonna test her spine. So can you? Okay, her spine is flat and not curved at all. Can you stand back up? I'm gonna auscultate, and then do you have any pain when I do this?
No.
Okay, you can take a seat. I'm gonna check your eyes. Okay, your eyes are symmetrical and they're perla, which is pupils are round and reactive to light and accommodation. Her conjunctiva is pink, and her facial qualities are symmetrical and even. Can you smile and frown and puff your cheeks? Okay, she has no problem doing that. She has no face drooping. Can you close your eyes and tell me where I touch?
Forehead, chin, cheek.
Okay, that just tests cranium nerve 5 and 7. Can you open your mouth? Okay, her mucosa membrane is pink and moist, and there's no lesions. Can you stick out your tongue? Her tongue has no lesions, and can you say ah? Her uvula moves when she says ah, and her tonsils are grade +2. I'm going to check your radial pulses and brachial. And those are +2 bilaterally. Then we test your capillary refill on all the nails. And that is less than 3. And then her nails are pink and smooth. And can you go like this, please? Okay, no clubbing present. Can you grasp onto my hands? Okay, muscle strength is good bilaterally. So I'm going to check the skin. And her skin is, check her legs and her feet. And her back, and there's no lesions or scarring present. It is appropriate color for her ethnicity, and it is moist and cool to touch. I'm going to check there's no edema in the legs bilaterally or in the feet bilaterally. And then the popliteal pulses are +2 bilaterally. Posterior tibial +2 bilaterally. And dorsalopedalis is +2 bilaterally. I'm doing the Babinski reflex, and that is negative. And now I'm going to check your carotid arteries. Okay, they are +2 bilaterally. I'm going to auscultate for any bruits with the bell. And they're none present. I'm going to check for heart and lung sounds. Check the lungs in 10 places. And on the back, again in 10 places. Lung sounds are clear. So this is the aortic, pulmonic, herbs, tricuspid, and mitral. I'll listen here for 1 minute for the apical heart sound, and then flip it over on the bell, and then listen back up again. Her heart sounds are good. There's no murmurs or no irregular beats. Can you please lay down? Okay. I'm going to check for vowel sounds. Okay, vowel sounds present in all 4 quadrants. I'm going to palpate. Is there any pain or tenderness?
No.
And I'm going to acetate. Okay, there's symphony in all 4 regions. I'm going to name everything in each quadrant. So in the lower right quadrant, there's your appendix, your right ureter, and your right ovary. In the upper right quadrant, there's the ascending and transverse colon, the liver, gallbladder, and pancreas. In the upper left quadrant, there's the stomach, spleen, pancreas, transverse, and descending. Then the lower left quadrant is the left ureter, left ovary, and the descending colon. Can you sit up? I would have her sit at a 45-degree angle and check for jugular vein extension, and none is present. Okay, and but can you lay back down? Okay, her stomach is flat and not distended, and then her stomach is 2 to 1. Sit back up, and we're good.